Today we're going to demonstrate an application of a total contact cast using the TCC-EZ system. The system comes commonly in 3 or 4 inch, these are the most common for most patients, either a 3 or 4 inch diameter cast. And so we are going to look at what's in the cast system. So when we open the box, everything is contained. Instructions are in here. Everything comes inside one package. We have stockinette, tape. There's a dressing in here for the wounds. Here's the padding, and then here's the fiberglass cast. So we'll open this up and place it on the cart. So when we start with the cast materials on the tray, you see that we have things in the order of how they were going to be applied. So if a dressing was to be used, we would put the dressing on first. Then we have the stockinette, the felt pad, the other padding, which is cotton, and the cast. It does help if you're going to do this especially by yourself, to have some tape already rolled out and then just stick it to the side of the tray, and you'll be ready to go. Important first to make sure that the table is at a comfortable height. You can apply this cast either in the prone position or the supine position. Some people find it easier to do in the prone position because it can help keep the ankle at 90 degrees. We'll demonstrate today in the supine position. So if you were to have an ulcer, the first thing you would do is use this dressing, and you could cut it out to place it over the ulcer. So let's demonstrate as if there was an ulcer on the plantar forefoot. So we'll just, and you can use the remainder of the dressing for padding. So even if the ulcer is relatively small, you can use the remainder of the dressing, which will give some added padding. Use the paper tape, which comes in the kit, and we'll apply this to the foot where there would be an ulcer. Okay, and that's all. So if you were to use some other type of dressing, that's allowed. Just apply it to the foot the same manner. So you could use something like negative pressure or even a graft. You would apply this to the foot first, secure it in place, and then move on to the next step. The next step is using the stockinette. So it's easier if you stretch it out and kind of roll it. When you're deciding how far proximal to place the cast, you'd like to stop at about the thickest part of the calf. So that's going to give it the best use. We leave a little bit of an edge here on the stockinette. And you want to take this higher than where the cast is going to go, because we're going to fold this down. Now, we don't want any wrinkles in this, so we pull to get all the wrinkles out, make sure that the dressing is still secured and the dressing itself is not folded on itself. This one did a little bit. You can see here how the dressing folded, so we'd loosen this to make sure that the dressing lays flat. We cut the end off. And then we want to tape this down to the toes, but we don't want to make this very tight because that's going to constrict the toes. So we just fold this over a little bit and then tape it down here with some of the plastic tape. Making sure we leave this loose enough on the end. Okay, so then the next piece is this felt padding. And this padding has protectors for the medial and lateral malleolus. It has a thicker side and a thinner side. The thinner side goes along the tibia, the thicker side goes along the foot. So this would be oriented this way. So we put these two pads around the malleoli, put this up the tibia. We want this to be on the foot here, but we also, again, don't want to make this so tight that it's going to pinch the toes. So I usually start here at the leg. Good. And then I'll secure the foot. And then with scissors, I'll cut the heel, because if you fold this back, you could get some creases here, and that would be harder to have a fit with the cast. So I'll cut the heel rounded. So this just fits at the end of the heel here, and then I'll do one more piece of tape there. And then one piece of tape to secure the malleoli pad. So then really your padding is done here. So the next step is to apply this cotton roll. So again, I'll roll this up to make it easier to apply. And you leave a little bit of an edge for the toes. You can stretch it and then place it on the foot like this. And then just roll it up the leg. And you let this go, even though the cast might stop at the thickest part of the calf, we let this go as high as it's going to go. And again, smooth out any wrinkles. We don't want any wrinkles in here that could cause a pressure point, which might risk causing an ulcer or a complication with the cast. So again, I'll feel like this to make sure that the padding has not moved or that the dressing has not moved. And if it has, you can even take this down like this. You can fix it and then roll it back over. And then we'll want to tape this down, not being too tight, but tape this down with enough room for the toes. So that's it for the tape. The next step is to apply the fiberglass cast. And so this cast comes in this package. You don't want to open this package until you're ready to apply the cast, because it'll start to dry and harden at that point. Some people will cut this with scissors, but you could end up over a period of time ruining your scissors because you'll get fiberglass on your scissors. So what I do is you can just rip it. And I'll rip the package like this. You can take the cast out. And then so the 3-inch cast is green and red, and the 4-inch cast, if you were to use that, is red and blue. So we roll this. And you get it all the way till you have just a little bit that's going to fold over where the toes are. So one of the differences between a total contact cast and a regular non-weight bearing below knee cast is that there is less padding, and this allows the cast to be closer to the skin and help to take up weight. And then there's also, this would cover the toes versus a traditional cast which leaves the toes exposed. And that, if you leave the toes exposed in somebody with diabetes that has an ulcer, you run the risk of getting extra pressure on the toes. So now we have this like this. We have already have a pail of water here. We want to put this in water. If you are new to this, you can use cold water because it'll take longer for this to set. If you use warm water, this will set pretty fast. So this is cold water. And once you just dip it like this, just run your hands around like this to squeeze all the water out. and it helps to move the resin around in the cast. And then squeeze the end. There we go. So now here we have the cast. So when we apply the cast, we want to leave enough room for the toes. Just place it on the top. Don't push very hard because you'll end up pushing the padding against the toes. But just start to roll this, and this will stretch to roll over the heel. Usually the heel is the hardest part to get this over. So this will stretch as soon as you get it over the heel, and then you can roll it up. And you want this to stop, as I said, at the thickest point of the calf. So that's going to be around right where this is stopping, right here for this example. So you want to make this all smooth. The toes, you'll stretch this out, fold this over, again, not very tight. This doesn't take very long to dry, but you want to be careful and maintain a 90-degree angle with the ankle. That's the most important part of this. Because if you have any plantar flexion, then that's going to increase the pressure on the forefoot or the midfoot. So we want to maintain a 90-degree angle, and that also makes it easier to walk. If there's any plantar flexion, it causes knee pain and back pain. So another pointer is not to keep your hands in one spot, because you can make an imprint with your thumb or your fingers or your hand, and that will add extra pressure. So instead, keep moving your hands around, and you'll feel if there's any wrinkles or any areas of pressure. And it's starting to heat up because there's a chemical reaction with the resin and the fiberglass. So you move your hands around, don't keep them in one spot, make sure that this is stays at 90 degrees. And this is the point at which I said perhaps some people find it easier to do this in the prone position, because gravity will help keep your ankle at 90 degrees when the patient is prone and their knee is flexed. But many patients can't get prone, and so you're going to have to learn how to do this both prone and supine. If this gets sticky, which is getting a little sticky now, you can do one of two things, and especially with latex gloves, you can use either soap or KY jelly, and then that will help to keep this from your hands from sticking to the fiberglass. But you can see how it's a little sticky now. So after about 5 minutes or so, this should be dry enough that it should hold the ankle at 90 degrees, and we can have the patient hang their leg over the bed. So this is pretty warm, and I think it's dry enough that this isn't going to move. So what we would do now is have the patient rotate. We would instruct them keep their knee off of the table, put their foot down, instruct them not to move their foot around, so try to maintain this angle of 90 degrees so that you can see that it's 90 degrees. And then when we're ready, we'll fold this padding down. We'll use scissors to cut this. And this provides a nice guide for you to cut with the saw when you're ready to remove this. And then we can fold down the stockinette. Sometimes the stockinette is tight, and if that's the case, then you can cut it, a slit in the stockinette to help it be easier. Now, oftentimes this is all that's needed. This is going to dry to the cast, but if not, you can take some Coban and you can wrap it around this, and that will keep this from lifting. You can see that this is pretty tight, and that's what a total contact cast is supposed to be. It's supposed to have some contact as close as possible to the skin, not a lot of padding, because that helps to take the weight from the tibia as the patient is bearing weight. In this particular type of cast, it's required to use a boot in addition. Now what this boot would do, and you can apply this while the cast is still drying in some cases. So what we do in that case is provide a flat surface for the patient to stand on, but apply this boot. You want to make sure that the heel is all the way in the back of the boot, and then we want them to be, their knee to be directly over the center of the boot, and you can start to secure these straps. And this helps even while it's drying. It helps to have the cast take the shape of the the boot. And so when the patient is taking the boot on and off, perhaps for sleeping, when they put it back on, it's already kind of the shape of the boot. And then you can tighten these after you have all the straps on. And there you have the application of a total contact cast, but specifically the TCC-EZ.